Hi, I'm Dr. Sridhar Kalyanasundaram. Welcome to my channel. And in the expert series today, we have Dr. Ashok Lodha, who is a pediatrician and neonatologist at Belhole Hospital. He's a pediatrician with great many years of experience, and his favorite topic is obviously screen time and its effects on children and their behavior. And he has delivered many lectures to pediatricians in Dubai on the same topic. And welcome, Dr. Ashok. Thank you for accepting the invitation.
Yeah, hi, Dr. Sridhar. Thank you for inviting me.
Thank you. So to start this, I would like you to give an overview of how screen time can be harmful in children, focusing on the younger babies and kids. How it affects brain development and what parents can do about it.
Yeah, uh, yeah, Dr. Sridhar, see the magnitude of problem. Uh, the 2019 census says that the world population is 7.2 billion. Out of that, 1.2 billion are kids below 13 years. And out of these 1.2 billion, 0.8 billion people are hooked to screens. So screen time is the time which is spent on the screen, which could be screen of a mobile phone, laptop, tablet, or for that matter, even TV or television also. Now, why it is important, why we are discussing it today, is because there are strong recommendations from American Academy of Pediatrics as well as UAE government that we all should limit our screen time. And recommendation clearly says that for kids, children below 2 years, including infant, newborn, there should be zero screen time. That means they should not be exposed at all before 2 years to screen. The only exception is during exceptional circumstances when the grandparents or parents are away, they want to see the child. So exposure should be 10-15 minutes of Zoom meeting, that's all. Now, between 2 to 5 years of age, the recommendation says screen time not more than 1 hour per day. And above 5 years, that includes teenagers and for that matter, parents also, it should not be more than 2 hours per day. Now, anything excess of that is excess screen time. Why it is relevant topic? Because in general, screen time affects 5-6 parameters of day-to-day life. When we are on screen time, especially kids are on screen time, they tend to overwatch what is called binge watching. That can result in binge eating, and binge eating can result into obesity. And obesity has its own associated multiple problems. So this is one of the commonest reason. And secondly, when they are on the screen, they get less time to do physical activity as well. Number two problem is sleep associated, especially in the night time. These screens emit a lot of blue rays. So this blue light affects melatonin production in our body. And melatonin, as we all know, is a good hormone for inducing good quality sleep. So most of the kids in the night, if they watch, they have sleepiness, insomnia problem, and they feel sleepy next day. So that affects their school performance as well. And number three is behavioral issues. When they are hooked to the screen, they don't realize from a hobby it converts into habit, and when habit converts into an addiction, they just don't realize. It's a very smooth transition. And once they are hooked to it, then they develop addiction, and the withdrawal symptoms are bad. It can show in form of behavioral symptoms, especially in teenage. Either they can go into depression, anxiety, or frustration. They show temperamental changes. When they post something, they don't get likes, they get depressed. And when they get less likes than their other peer group, then also it shows behavioral changes. And sometimes the teenagers are into some sites or gaming which is not appropriate for their age. For example, violence in the game or any media or movie they are doing, then they also have that habit of violence, and they can go into wrong direction. We have seen what's happening in US, the shooting by the school age children as well. So these are dangerous things which are for teens as well as older child. But especially the preschool age children between 2 to 5 years. This is a very crucial phase where they need to have stimulus by human face, by eyes, for their brain to develop their cognitive skills. If they are on screen time in excess, then their cognitive skills are hampered. their social interpersonal skills are hampered because they are not interacting with human faces, and their motor and fine motor and gross motor milestones are also decreased. The important category of children is below 2 years of age, because that is the time when children, the parents can have a control over their babies. Once they are about 2 years, it will be difficult to control. See, below 2 years, the brain is developing very fast. They say that maximum brain growth is up to 2 years, the head circumference wise. So, anatomically as well as physiologically, it needs to be protected from the harmful radiations which are emitting from our Wi-Fi, because their brain, the skull bone is thin, their brain is soft. It has so radiations can penetrate better the thin skin bones. Even it can cause thermal injury to the soft tissue and skin as well as to the brain. Prolonged exposure will interfere in their brain development. And that is the time when right habits can be inculcated by the parents if they limit the screen time.
In terms of what they can do to improve this, I mean, how can they regulate it? I mean, in the first 2 years, you mentioned about the impact of when the brain is rapidly growing and developing its channels and connections. So the videos are edited and they're very fast. And as you said, there
Yeah,
is no two-way communication. So they think that that is the way in life. And so even problems like behavioral problems, tantrums, autistic spectrum, these kind of problems, we see a lot because of that, isn't it?
yeah, that's a very valid point. Our brain is designed to mature or develop only by human interactions. When a person talks to a baby, brain needs some time to accept, assimilate, rationalize, understand, and store that memory. It needs time. But whereas if he is hooked on to a screen, there are rapid bursts of audio and visual stimuli, which a young brain finds it difficult to absorb and assimilate. So that's where his cognitive skills development in the brain is hampered. And later on, he has problem in interpersonality skills also when he joins the school. So it's high time that parents should realize this and control the screen time at home.
And in terms of what parents can do, can you guide young parents on how they should approach this?
Yes, I can share a small screen which shows that um, what they can do at home. So that this is in fact a brief take home message for the parents, what they can do. Uh, Sridhar, are you able to see my screen? Yeah, my screen is on your screen. Are you able to see?
I can see, yeah.
Yeah, okay. So as I told you in beginning, American Academy says that below 2 years, even UAE government also recommends that zero screen time for children. Between 2 to 5 years, preschool kids has to be just 1 hour per day. Children above 5 years, it should be limited to 2 hours per day. Now, family can make a family media plan. They can sit with especially if they have older child or teenage child, they can sit with them and decide how much time, at what time, and what to see. This can be discussed, and then they should stick to that plan. Take into confidence the teenagers so that later on the compliance will be good. There are some good online resources which can help you in making this plan. It is called commonsensemedia.org. Uh, just two more things. Family can surely decide that there should be tech-free zones, especially when they are going to sleep in the bedroom area, and there should be a screen curfew time once they sleep from, let's say, 10 p.m. to 6 a.m. There's no reason why a child should be hooked to the screen. These are small things which will help in reducing the screen time, and it will surely help in making a healthy living and the good development of the preschool children also.
It's very helpful. I think you can stop sharing the screen. Uh,
Yeah.
and I think it's a very useful presentation and discussion. I mean, obviously, very important topic, and parents should take it seriously right from the beginning. And normally, all pediatricians should imbibe this and tell the parents at the 4-month visit onwards that screen time should be monitored. And only exception, as you said, is to maybe chat with the family on a brief video chat. One of the suggestions, if a child is used to screen time, how to wean them off it is to play a slideshow of their own pictures, possibly, rather than an edited video image. So these are points that might help them wean them off a habit. And older children should be controlled when they have younger kids as to when they watch it, because they're already used and they may tantrum. So it's a
Yeah,
crucial topic, and I mean, I'm sure the
yeah,
pediatricians who deal with children with developmental delay or autistic spectrum or language delay see a lot of this. They stop showing them videos and then they start speaking well within 3-4 months and
yeah.
interacting well. So that two-way process is happening, which people don't realize the importance.
Yeah, I'm really happy, Dr. Sridhar, you brought this topic because we as a pediatrician have a very important responsibility because we see them during vaccination first year of life up to 2 years of life. So at that very time when it is just beginning of getting addicted, they need to be educated. The awareness has to come. And children, actually whatever we have spoken, it's already available in the internet. But when his doctor, kids pediatrician, when they say the parents do take it seriously. So this is a very good step you have taken, the awareness. I'm happy about it.
Thank you. Thank you so much for your time, and I hope it helps the viewers. If you have any comments or questions, you can post in the comment section. I would like to thank Dr. Ashok again for his time, and thank you for being here.
Okay. Thank you very much, Dr. Sridhar.
Thank
Bye.
you.